continuing the series of solving previous question papers, we will see question number 3, which was asked in paper 1 of Jan 2025 General Medicine. So, question asked was about the pharmacokinetics, pharmacokinetic changes in elders, and what are the principles to be considered while prescribing medications in elders. So, things to consider while prescribing. So, not only for the sake of solving question, this topic is very important even in practice. So, we deal with many elders. The physiological and pharmacokinetic things in elders will not be same as other adults. So, we have to consider all those things here. So, coming to the first part of the question, pharmacokinetic changes. We know that when we see the term pharmacokinetics, it will mainly involve absorption, then distribution of the drug, then it will be metabolized, so metabolism, then excreted. So this is the basic pharmacokinetics of any medication. So in elders, mainly in case of absorption, we know that the GI motility will not be that good. So the drug will be in the GI tract for longer time. So the motility is reduced, motility is low. Even the gastric pH will be altered. So gastric pH is altered in elders. That will affect many drugs, and the absorption will not be that good as in case of adults. So poor absorption. So if we are giving a particular drug, if there is no proper absorption, then we will not be able to reach target levels. So these are the difficulties which we will face. Coming to distribution of some drug. So when we see the term distribution, mainly how the drug is getting distributed in the body. So we see water component of the body, fat component, and mainly albumin related things. And we know that as age advances, water content of the body will be reduced. So decreased water levels in elders. In such case, if we are using water soluble medications, so that will lead to increased levels of such medication. So increased levels and risk of toxicity of water soluble drugs will be there in elders. Coming to the fat, we know that as age advances, there will be increase in fat content of the body. So fat soluble lipophilic drugs will be stored or start getting accumulated inside the fat tissue. So the drug availability will reduce automatically. So here consider lipophilic drugs will be accumulated in fat tissue. Coming to albumin, we know that many drugs when taken will get bound to albumin and will be released slowly during their action. But in elders, synthesis of albumin will be physiologically reduced. So there will be lesser binding of drug to albumin. So we can see more effect in an early duration of the drug prescription. That is related to distribution. Coming to metabolism, and we know that majority of the medications will get metabolized in the liver, and obviously as age advances, metabolism will slow down. So liver metabolism is slowed down, and the famous enzyme which is involved in metabolism of many medications, cytochrome P450, this activity will also be reduced. So it will definitely affect the effects of drug. Coming to the excretion, if we consider renal excretion of majority of the drugs, renal excretion, physiologically there will be reducing GFR in elders, so that can also affect renal excretion of drug, and commonly we see kidney diseases as age advances. So both can adversely affect a drug's pharmacokinetics in relation to excretion. So this one we can consider as the part of first segment of the question. Coming to the second one, which is very important when we deal in day-to-day practice. What are the things to be considered while prescribing medications in elders? So for this one, you just imagine you are sitting in OPD and some elderly person with, for example, cardiac, even renal disease, both together, is coming to you at your OPD with all the medications which he or she takes. So what should be your idea? That is the second part of this question. So if you imagine that situation, definitely we will consider low dose and we will go slow. This is the first thing we have to consider in elders. Always start low and go slow. Then we have to simplify the regimen which we want to give, or if they are already taking something, we have to simplify it. So simplify the regimen. And as in our case, the individual might be having renal and cardiac disease. In such case, they need to take multiple drugs, which will be a problematic thing for many individuals. So as much as possible, avoid polypharmacy. So this is done using combination drugs. Then once we have simplified the regimen and we have started using combination medication, then we have to explain them the possible adverse effects. So adverse effects should be explained, mainly confusion, dizziness, and falls. If you see the chapter of aging in Harrison, they have mainly focused on falls and frailty. So elders are very frail, and over that we should not be prescribing such medication which will lead to further adverse effects. Then during that time only we have to consider the age-related changes in pharmacokinetics, which just now we discussed, and all the comorbidities the individual is having, all the comorbidities. So if we consider these things while prescribing, we can adjust the dose according to comorbidity. Then we have to regularly follow up the case, regular follow-up. And during such follow-up, we have to look for adverse events or adverse effects of medication, and we have to assess renal function, if possible liver function also, and during such follow-up we have to spend some time to ask the individual whether they are able to tolerate the medication properly or not. So always it should be patient-centered care. Sometimes the taste of the medication will not be tolerable to the individual. Even then they will be forcefully taking the medication. So such minor things we might miss asking. So in follow-up we have to ask such things, and if possible we can replace the medication. So these are the things which we have to consider while prescribing medication to elders. This is question number 3 of paper 1. Hope you got the point. It will be also helpful, as I told, in day-to-day practice. So if you like the content, please subscribe to the channel and share it with your friends as much as possible, so that we can reach maximum number of medical students as well as practitioners. Thank you so much. Meet you in next video.